everyone, I am Dr. Zain Khatib, cataract and refractive surgeon from Khatib Eye Clinic, Mumbai. Today I am going to be discussing a very rare but very dangerous eye condition called as retinal detachment. So what exactly is retinal detachment? So we know that this is the front part of the eye where there is the cornea, and this is the back part of the eye called as the retina. So light, when it comes into the eye, it comes and focuses on this retina. Retina is the photosensitive layer of the eye, meaning it converts the incoming light into a visual signal, which then goes to the brain via this optic nerve, and we are able to see. So the eye, if you compare it to a camera, the retina is comparable to the sensor of the camera, which is the photosensitive part of the camera. Similarly, the retina is the photosensitive layer of the eye which converts light energy into a visual signal. Retinal detachment means the retina has come out from its normal position and it has detached from the wall of the eye. So this white part is the wall of the eye, and when the retina is detached from that, it is called as retinal detachment. So why does retinal detachment happen? How does it happen? Let me try explaining this to you. So for this we need to understand little bit about the normal physiology of the eyeball. So you can see that the retina is fixed to this wall of the eye, which is called as the sclera. Now actually the retina is not fixed to the sclera, but rather it is pushed towards the sclera by this part over here. So inside this hollow part of the eye is a jelly called as vitreous humor. This vitreous humor, it pushes the retina against the wall of the eye, meaning the retina is not actually fixed to the wall of the eye, but it is just pushed into place by this jelly. So if something happens to this jelly, that means it will not have the same pushing power on the retina onto the eye wall, and this is what happens in retinal detachment. So to understand in detail, for retinal detachment to take place, three things need to happen. First of all, this jelly of the eye, it needs to have some fluid inside it, meaning it is not exactly a jelly but some amount of fluid if it is there inside. That is the first condition. Second condition is, in some part of this retina, this entire orange part is the retina, in some part of this retina there needs to be a hole somewhere. So when there is a small tear in the retina, that results in a hole. So that is the second criteria needed for retinal detachment. And the third and most important criteria is that the fluid which is in this jelly, it goes through that retinal hole between the retina and the eye wall, and it pushes the retina forward, and this is what is called retinal detachment. So these three criteria are needed for retinal detachment to take place. So what are the risk factors or what are the causes for retinal detachment to happen? So the two most important risk factors for retinal detachment are, the first is in people with a high minus number, or rather in those who are nearsighted or short-sighted or myopia. In people who have numbers greater than -6 or -7 diopters, these people are at a high risk for developing retinal detachment, because in such patients, inside their jelly there are small fluid pockets present, and also they are more predisposed to get tearing of the retina. So in these people there is a high risk for retinal detachment. The second risk factor is in people who have had injury to the eye or trauma to the eye. So any form of trauma, very commonly blunt trauma when people undergo fist fights, or even any penetrating injury if a nail or something has gone into the eye. In such conditions, retinal detachment can happen. So besides being short-sighted and besides having eye injury, are there any other risk factors? So there are some other risk factors, but they are not very important. Retinal detachment can happen normally also in older individuals without any risk factor, but this is extremely rare. Overall, retinal detachment is a rare disease, but if it happens, these are some of the risk factors as to why it happens. So now let us understand what are the symptoms of retinal detachment. So retinal detachment doesn't happen all at once. There are stages. Okay, so first a patient may undergo a retinal tear. So when the retina tears, it doesn't get detached. For some time there may only be a tear, and if that tear is not treated, then the fluid goes from the vitreous jelly behind and detaches the retina. So only when a patient has a retinal tear, they may get a sudden burst of light from somewhere, okay, what we call as a flash of light. So when they turn their eye, there may be a flash of light because that toned retina gets pulled by the jelly. So flashes of light, and second symptom is floaters. Suddenly the patient sees a lot of black spots in their vision floating around. These are called as floaters. So whenever a patient feels sudden flashes of light or they feel floaters, that is black spots moving about, they should always consult their eye specialist, because this can be a sign of a retinal tear. And a retinal tear before the detachment takes place is something that needs to be treated, because once the detachment happens, the treatment becomes very difficult. So only if a retinal tear happens, these are the symptoms. And once the retina gets detached after a retinal tear, that is, if the retinal tear has not been treated and the retina gets detached, then the patient gets a sudden loss of vision, meaning suddenly the patient will feel that the vision has become totally black in that eye, and then they come and show the doctor. But if the patient can understand before the detachment has happened, if there is a tear with the symptoms I told you, then that tear can be treated and the detachment will be prevented. So what is the treatment of a retinal tear and retinal detachment? So as I told you, if there is only a retinal tear and there is no detachment of the retina, a simple OPD procedure called as a laser barrage is needed, where with the help of a laser, the tear is marked on all sides, and that makes the tear get adherent to the eye wall below. And because that happens, the retina will not get detached. So this is prevention of retinal detachment and treatment of the retinal tear. And this is the best way to treat it, because if the retina doesn't get detached, the patient will not lose any vision. Suppose the retinal tear has not been treated on time and the retina has got detached, then the only treatment option is surgery, and the surgery has to be done soon. So what does the surgery do? If this retina is detached during surgery, either gas or oil is put into this jelly, which pushes the retina back into place, and along with that, the laser barrage is done on the retinal tear wherever it is. So this is about retinal detachment surgery. It is quite a complex and technically demanding surgery, but if it is treated on time, the vision loss because of retinal detachment can also be treated. Now coming to one very important aspect, when does retinal detachment treatment have to be done? So ideally, the moment a retinal detachment is detected, immediately on priority the surgery should be done, because the more amount of time the retina is detached, that much less it will derive nutrition. So the retina derives its nutrition from the back eye wall, and the more the retina is detached, that much less nutrition it will have, and it will start becoming less and less nourished. Meaning what? That instead of 5 days of detachment, if 3 months of detachment have passed and then we do the surgery to reattach the retina, the vision will not improve 100%, because for those 3 months the retina has not got its nourishment and some of its tissue has started dying already. So the faster we do the retinal detachment surgery, the better chance of vision recovery after surgery. Most of the times after a retinal detachment has happened, the 100% vision is not regained unless and until only 1 or 2 days have passed after the detachment has happened. If more time has passed, then most of the times 100% vision is not regained after retinal detachment. That is why it is so important to prevent detachment from happening rather than treating it once it has already happened. And the only way we can prevent it from happening is if we manage to do a laser barrage on the retinal tear which has already taken place. So the most important take home message from this video is, if you have high risk factors, like if you have undergone trauma to the eye, or if you have a very high minus number, you should get your retina checked up at least every 1 year. And if your doctor has told you that you have a retinal tear, immediately you should get the laser done, which is a simple OPD procedure. It will prevent retinal detachment from happening, because in retinal detachment, prevention is always better than treatment. So this was a little bit about what is retinal detachment and how it is treated. Thank you and stay tuned for more videos.